So now we're going to cover treponema pallidum, which causes the well-known sexually transmitted disease, syphilis. The drawing will be about a space observatory called Pallidum Observatory. That's right, syphilis in space. Treponema and pallidum sound so space-like, hopefully it'll be an association that really sticks. Syphilis has several stages of presentation and is often called the great imitator since many of the symptoms look like many other diseases. But let's take it step by step and you'll be just fine. First off, transmission. As I said, syphilis is a sexually transmitted disease. It's not nearly as common as chlamydia or gonorrhea, especially nowadays, but it is still something to watch out for. And more recently, it's actually seen a slight rise in incidence, so it may actually be more fair game now. Okay, let's go over some general characteristics. Treponema pallidum is a spirochete, which of course means it's a spiral-shaped bacteria. To represent this, we have a galaxy in the top left corner that's sort of spiraling around itself, as galaxies do. We also have this spiral staircase leading up to the telescope room. Remember these spiral shapes, and you'll have no trouble remembering spirochete. So now what's the name of this galaxy? Well, this brings us to our next topic, and this has to do with the lab technique used for identifying treponema infection under microscopy. This galaxy is called the dark field galaxy, alluding to the fact that dark field microscopy is needed for direct visualization of the organism. Notice how we have this researcher peering through the telescope to look at the dark field. This is analogous to a researcher peering through a microscope looking at a dark field. I have to say that's pretty cool. In order to perform dark field microscopy, you need to take a direct sample from a lesion on the patient. However, it's not the most commonly used tool, as it's fairly time-consuming and not all labs are equipped to use it. Instead, infection is usually diagnosed through blood tests, which we'll also demonstrate with this portion of the observatory. First, let's talk about the main screening test, which we'll represent with this display screen. We're labeling the display the video display for the research lab. In short, that comes out to be VDRL, which is the usual screening test for treponema. You know that this is a screening test and not the confirmation test because it's the laboratory TV screen, not TV confirmation test. The VDRL test actually stands for Venereal Disease Research Laboratory and is a non-treponemal test, meaning that it's not specific for treponema pallidum. It's just testing for antibody reactivity in patient serum to a particular antigen, cardiolipin cholesterol lecithin, if you want bonus gunner points. Another screening test you may hear of is RPR, or Rapid Plasmin Reagent. While these are both used as screening tools for patients with symptoms or those at high risk, there can be several reasons for a false positive due to cross-reactivity with other antigens. There are quite a few. We've added a short list of the most common ones here. This list is supposed to look like a list of different galaxies. Galaxies nowadays are assigned some pretty weird names with some random collection of letters and numbers because there's so many of them, and it kind of looks like this abbreviated list. So if a patient has mono, rheumatoid factor, lupus, or leprosy, they could be read as a false positive for syphilis, and this can also happen if they're an IV drug user. It's probably not necessary to memorize this list, but just try to be able to recognize them. Because of all these possibilities for false positives, it's important to have a confirmatory test. That's where our telescope comes in handy. Behold, the field telescope A to AB, or what you would recognize as the FTA antibody test. As opposed to VDRL, this is a treponemal test that is used after the non-treponemal tests show reactivity. The test detects antibodies that are directly against treponema pallidum, and as such, it's much more specific for treponemal infections than VDRL. Okay, let's go on to our clinical presentations. Syphilis can be broken down into early and late stages. The early stages, which occur in the first year, are primary, secondary, and early latent. The late stages are usually tertiary and late latent. We segmented all of this nicely in our drawing. Primary syphilis will take place in the dome up here, secondary will take place on the floor below, and tertiary will be outside, as well as congenital syphilis. So primary syphilis is characterized by a painless genital chancre. that appears a few weeks after inoculation. It causes this chancre by locally invading small blood vessels and damaging them, which then leads to small areas of ischemic necrosis, producing a chancre. The ischemia also takes out the nerves, which explains why it's painless. We'll demonstrate primary syphilis with this sundial that seems to be poking our astronomer in the butt. The sundial itself is somewhat phallic, so it will remind you that the chancre appears on genitals. And to represent painless, our astronomer doesn't really realize that it's poking him, and he's continuing to work, so it's painless. So the chancre will heal in 3 to 6 weeks, but if left untreated, which can happen since it's not painful, it'll progress to the secondary stage, which we'll talk about on the lower level of the observatory. Here we have a solar system hanging. System being the operative word for the secondary stage of syphilis. It's a systemic disease, which is no longer localized to the genital region. Now I'll have this astronaut be leading a demonstration on the solar system. The astronaut's suit is white, except for his hands and soles of his feet. This is to demonstrate the characteristic maculopapular rash that occurs weeks to months after infection. Now, he said that it's a systemic disease, so the rash actually develops everywhere. However, the presence of the rash on the hands and soles of the feet is an important clue to a diagnosis of syphilis. Only a select few diseases have this classical finding, and syphilis is one of them. Now, our astronaut's pointing to a rather unusual looking planet that has a bumpy exterior. This is to represent Condyloma lata. It has a lata bumps. But don't get confused with Condyloma acuminata, which happens with HPV and is more wart-like, whereas Condyloma lata tends to be more flat-topped. So just remember this planet with a lot of bumps, and you'll think of Condyloma lata. You'll notice the kids listening to the talk have telescopes in their hands. This is to symbolize that you can visualize the spirochetes within the Condyloma lata via dark field microscopy. Notice the telescopes are dark. So there are several other symptoms in this stage. However, the two we mentioned, the rash and the Condyloma lata, are the most important by far. Now we'll move on to the tertiary stage. So let's move outside. The first thing we'll add is this bright cratered moon. The craters are supposed to signify gummas, which are soft growths with a firm necrotic center that can occur anywhere, skin, internal organs, or even bone. Another manifestation of tertiary syphilis is aortitis, particularly of the ascending thoracic aorta, which can lead to an ascending thoracic aneurysm. Pathologically, the aorta demonstrates tree barking, or looking thick and wrinkled like a tree bark. Thus, we have a tree in the shape of an aorta, to help you remember this buzzword, tree barking. Syphilis destroys the vasa vasorum, or small blood vessels that supply the thick wall of the aorta. To remember this, you can think of syphilis as targeting the roots of the aorta tree, because roots are the supply that keeps the aorta tree alive and healthy. Or you can think about it logically. In primary syphilis, I said the microbe damages small vessels, leading to the development of the chancre. It's a similar mechanism here. The microbe damages small vessels, leading to weakening of the aortic wall and aneurysm formation. The next symptom we're going to cover of tertiary syphilis is called tabes dorsalis, or the demyelination of nerves in the dorsal or posterior columns of the spinal cord. This leads to a loss of vibration sense, proprioception, and discriminative touch. This can also accompany lancinating pain all over and an odd gait due to the loss of proprioception. So to represent damage to the posterior column of the spinal cord, we'll add some columns here in front of the pallidum observatory. Notice the columns are in the back of the picture, so these are posterior columns that we're showing are cracked and damaged. Along with this spinal cord damage, you can also see some ocular effects. It causes neuronal damage that leads to a distinct defect called Argyll-Robertson pupils. These are pupils that accommodate but do not react to light. So to represent this, we'll add a greeter in front of the observatory, and we'll have him wearing an Argyll sweater to help you remember Argyll-Robertson. Notice he's being extremely accommodating, even though this bratty kid is shining light directly into his eyes. I'll zoom in here so you can see that his pupils are still dilated and non-reactive. You might have heard of the term prostitute's pupil. However, we didn't think many prostitutes worked the observatory corner, so we chose not to demonstrate it that way. Okay, lastly, we'll cover congenital syphilis. This is definitely not as prominent as it used to be, especially since it's become standard to screen pregnant women, but you may see this in developing countries. But if it were to occur, it would present with a constellation of symptoms in children. Constellation? Ooh, another reason why this space theme is so awesome. Anyway, looking at the top right, we have an Orion-like constellation. This hunter has a sword, more specifically a saber, that ends near his shins to represent the buzzword saber shins, which is simply an anterior bowing of the tibia. We also see a saddle on the Pegasus constellation to symbolize a saddle-shaped nose, which looks like a stubby nose with an indented bridge. So this saddle for saddle nose. Now we'll add some shivering kids down here below. Their teeth are chattering, and this is to remind you of Hutchison teeth, which are notched incisors, and mulberry molars, which are molars with several enamel outgrowths. So it's freezing outside, and the kids are wearing earmuffs, and these earmuffs are to represent that they're deaf, which is the last symptom we're going to cover for congenital syphilis. Those are the high-yield buzzwords you'll need to know about congenital syphilis. There are more symptoms that are present immediately at birth, such as hepatomegaly, rhinitis, and rash, but those are pretty nonspecific. So that's a lot of clinical stuff. Luckily, treatment is super simple. It's penicillin. Penicillin is always the answer, in every stage and in everyone. You'll notice we're adding a bunch of purple pencils, our recurring symbol for penicillins. So what about people who are allergic? Well, there are other treatments, such as tetracyclines, but the answer you should choose is to desensitize them and use penicillin, especially if they're pregnant, since tetracyclines are contraindicated in pregnancy. The last thing we'll mention is something you may see in a patient with syphilis that's being treated with penicillin. We'll sketch in this sign for the Jarisch-Herxheimer comet viewing. And this is because the reaction is called the Jarisch-Herxheimer reaction, and it's essentially the dying spirochetes releasing a bunch of LPS that cause an increase in cytokines. And this leads to symptoms of fever, chills, and headache, which begins within hours of treatment. And it used to be a good indicator that the treatment was working. So to represent this, think of this giant ball of fire and ice flying through space, a comet. The fire and ice is to remind you of the fever and chills associated with this reaction. So that wraps up Treponema pallidum and the disease syphilis.